Hello. When a person you are caring for becomes unwell, there are different options for looking after them. For some people, it will be appropriate to call the GP or 999 to arrange admission into hospital. However, for some people, going into hospital is not appropriate. This can be for a number of reasons. Often people who know they are approaching the end of their life may have decided that they want to die in their home and not in hospital if possible. There are two documents available that support people to have a say in their care when they become unwell, even if they cannot express their wishes. These are called treatment escalation plans and resuscitation decisions. A treatment escalation plan, or TEP, is a personalised recommendation for someone's medical care. It is for use in an emergency situation. A treatment escalation plan is made with the person and their medical team, and often with their next of kin. It is ideally made when they are well and can say what they would want to happen. Occasionally, a treatment escalation plan is made after a person has been unwell and it may not be in their best interest to be readmitted to hospital for further treatment. The plan should include details about where the person wishes to be cared for and what treatments they would or would not want. This can include medication, surgery, intravenous antibiotics, or help with breathing. Depending on where you work, there are several names for treatment escalation plans. These include RESPECT, Advanced Care Plans, Living Wills, and Advanced Decision to Refuse Treatment forms. Cardiopulmonary resuscitation can involve chest compressions and shock therapy in an attempt to restart someone's heart. Resuscitation is more likely to be successful in someone who is fit and well than in someone who is frail with medical problems. Decisions regarding do not attempt cardiopulmonary resuscitation or DNA, CPR may be included in a treatment escalation plan or be documented separately. They advise emergency teams on whether they should or should not attempt resuscitation. Even if a person has a DNA CPR in place, this does not mean that they cannot be treated for other conditions. For example, they may still benefit from antibiotics for an infection or first aid for an episode of choking. As a carer, you can support people in having conversations about their end-of-life care preferences and help to arrange a treatment escalation plan with their GP. You should understand whether a treatment escalation plan and a resuscitation decision exists and what it says about that person's wishes. You need to know where these documents are kept so that you can access them in an emergency. If you have any questions, please speak to your manager or a senior colleague.